Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is my hip pain coming from a hip problem or a lumbar spine problem? Hip pain is very common. Millions of Americans suffer from hip arthritis, and the pain may cause disability, limited ability to walk, participate in recreational activities. 300,000 total hip replacements are performed every year in this country. And when pain is occurring in the hip area, it seems obvious to assume that the problem is coming from a problem in the hip joint, but it may not. When pain is being felt in the hip, it could be an overlap in symptoms between hip arthritis and what's called lumbar spinal stenosis. As individuals age, spinal stenosis is very common, and both occur from degeneration. Here's a cartoon of spinal stenosis. Here's the disc area, then you have the canal for the spinal cord. Normally this is almost like a circle or an ellipse, okay? But here it's a triangle, and that occurs when you start to get bony overgrowth from joint arthritis, and you also get soft tissue overgrowth, and it impinges on the spinal cord and the nerve roots as they're trying to get out. That's called spinal stenosis, and it may cause pain that in the hip that mimics arthritis pain. So how do you differentiate between the two? Here's a quick example. A side view of your spine. Here's the spinal cord coming down, and then bulging coming backward from this disc, and then arthritis overgrowth coming forward, and you get pinching right there. And here's an arthritic hip. You have minimal joint space, whereas on the normal side you have an excellent looking joint space. See this little area here? Okay. Then you have, they call it sclerosis, or hardening of the bone. It looks more white. You have some cysts, which are these little circular areas. And that's an arthritic hip. So the ways to differentiate, when you get a history from somebody, you want to listen to where the area of the pain is, when does the pain come and go, how long does it stick around. Hip and the spine source can cause referred pain down the leg. Okay, so that doesn't necessarily differentiate between the two. On physical exam, if someone has point tenderness over the hip area, that's more in line with a hip problem. If they have pain with range of motion, that's more in line with a hip problem if it's of the hip. A neurologic exam is not really helpful. Imaging studies can be helpful, but they're not definitive. For instance, here's an MRI, and you can see what that cartoon showed with the triangle as opposed to a circular. So here you have spinal stenosis, okay? Now, there's a CAT scan as well. So this can give you a hint that spinal stenosis is causing a problem, but it doesn't necessarily tell you definitively, because you may have this and have no symptoms whatsoever. And once again, the arthritic hip versus the normal hip. And just because you have this amount of arthritis doesn't mean it's going to be painful at all, really. The best way to tell is with a diagnostic injection. So if you inject lidocaine, which is numbing medicine, into the hip joint on a side that has arthritis and pain, it should cause pain relief within 1, 2, 3 minutes, okay? That will tell you all you need to know. Now, an epidural injection, which is where you put steroid medication right around the nerve root being pinched, it may not work the first time, or you may need a series of injections. So what are the potential outcomes with these diagnostic injections? Well, if you get complete hip relief with a hip injection, then you have a hip problem, no question. Okay? If you get complete hip symptoms relief with an epidural injection, that's a lumbar spine problem. So those two are very clear cut as to what the diagnostic injection shows. If you get some relief from injection into the hip joint and the rest of the relief comes from an epidural injection, you have a combination of the two. There's always the possibility that neither injection will work well, and in that case, further investigation is needed. The top non-operative pain management in Washington is through the Washington Pain Network. There's multiple clinics accepting over 50 insurances, with over 25 treatment options being provided for all types of pain conditions. Overall average success rates exceed 90% with the board-certified, award-winning doctors. So visit us online at washingtonpainnetwork.com, and then give us a call for more information and scheduling, 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.